So typically what I do for the 130 students, when you're, when you're coming back after taking the 110 test last semester, is really just highlighting and focusing on what's new. And really what's new for you is two things. You're going to do flow rate questions, which include calculating flow rate in milliliters per hour, as well as calculating a drop rate in drops per minute. And so showing you some scenario questions, working through those again, and then leaving a few blank for you to work on your own. And then what's considered a multi-step or two-step problem, which really just means you're taking the patient's weight, if it's in pounds, converting it to kilograms, and then multiplying by whatever the weight-based calculation is, and kind of introducing that. But everything else is pretty much the same. You need to know your unit conversions. You need to know to convert, how to convert milligrams to grams, micrograms to milligrams, vice versa, how to convert pounds to kilograms, teaspoons and tablespoons and ounces to milliliters. And you're going to have that same kind of first few questions that look like this, where you have some kind of straightforward conversions. As a reminder, when you go from milligrams to grams or micrograms to milligrams, you don't round your answers. So if you get an answer that's like 1.052, that's your answer. Don't round that to 1.1. You don't typically round when you're going metric to metric, but you will round if you go from pounds to kilograms, and then you will round when you're doing some of the other medication-based calculations when you're administering, because it's very difficult to administer 2.675 milliliters of a particular thing. You just keep it very simple and say 2.7 milliliters. Okay, but we'll go through some examples of that. So I'm going to start off with just focusing on what's new, because everything else is just a refresher, practicing some of the things, some of these questions you've seen multiple times. Now that if you've been kind of practicing. So what I'm going to do is I'm going to go through some of these flow rate questions. I already went through these in the first hour. But I'll go through them again in the second hour. Actually, I'll go through the ones that I didn't go through. And then I'll cover some of the differences that are pictured here. So when you're calculating a flow rate, what you're looking for is a volume over time. Okay. And so the volume over time in a typical flow rate is just milliliters per hour. So in a given example, it might just be as simple as it tells you how many milliliters, tells you how many hours, and you just need to reduce the number so that it's something like, 250 milliliters per hour, and just keep it like that. So for this, I'm actually going to just change this up a little bit, just so you have a little bit of a difference in your numbers. So let's say the order is 650 milliliters Ringer's lactate over 3 hours. What would you program to the infusion pump? For this question, all they're asking you to do is take the volume divided by the time and then reduce it, where you're going to use your calculator to do that. So you're going to take 650 divided by 3, and you're going to get 216.66666. It's just going to keep on going, milliliters per hour. And then you're going to round your answer to the nearest tenth. So you'd round that to 216.7 milliliters per hour. Now, sometimes you may get told, like, at least in a clinical setting, you might actually round that up to 217. You might round it down to 215 or round it up to 220. Sometimes it just depends on what you can program into the infusion pump. But from a math standpoint, round to the nearest tenth, and that way, you're at a more accurate number based off of the calculation. Most likely, you're going to get something like 750 milliliters over 3 hours, and then it's 250 milliliters per hour, and you won't have to worry about any decimals. But if you see it, you now know to round to the nearest tenth. I ran this, or I asked this question, and what I'm going to do is I'm going to create a alternative scenario. So I'm going to add a new question here. I'm just going to add it down here. All right. So it says, should just get rid of all the numbers. Okay. Whatever. Okay. So what I'm going to do here is I'm going to just change this up, and I'm going to say, let's just say this is 1.25 liters, and it's infusing at let's say 225 milliliters per hour. And the question is, how long will this infusion take? And a lot of times what they're asking you to calculate is how many hours it's going to take to complete. So I might actually make this 250, because I think if I make it let me just see what that would be real quick before I give that to you as a scenario, because yeah, I don't want that. I say 250. Okay, that'll work. All right. So 1.25 liters, and it's infusing at 250 milliliters per hour, and we want to know how long will this infusion take. Basically, when will it be done? So in order to solve for that, I have to first convert my liters to milliliters. So 1.25 liters is the same thing as 1,250 milliliters. Then I'm going to eliminate milliliters and solve for hours. So 250 milliliters per hour. Now, if you want to look at this, that you want to do like desired or ordered over have, or ordered over available, desired over have, that still works for this. You can take the 1250 divided by 250 times 1 hour. It's essentially the same thing that I've put here. 1250 divided by 250 gives you 5 hours. So to answer this question, how long will this infusion take? It'll take 5 hours. Alternatively, they might even say something like, it starts 10 a.m. on a Tuesday. In 5 hours, what time will it be? And then you can do that calculation using the 24-hour time format. So 10 is 1000, plus 500 for 5 hours would give you 1500, and so it would be done at 3 p.m. on Tuesday. Alternatively, you can say 10 a.m., then 11, 12, 1, 2, 3, and you're up to 5 if you want to do it that way. Okay. So those are kind of like the intro, milliliters per hour, calculate how many hours. The other thing you might see is something like where you have milliliters in minutes, and then you have to just remember to convert minutes to hours to get to your milliliters per hour. But I'll let you refer back to the previous video or the previous recording, unless you need to see that specifically, when we can certainly work through it. But I'll let you kind of look at that and see if it makes sense what I've written there. The next thing is drop rates. Now, drop rates, I'm going to show you, and then we'll work through the newer one, the one that I haven't worked through yet today. But I'll show you like the flow rate and how we calculate drop rate, and what information we need to know. So in order to calculate drop rate, you need to know 2 pieces of information. You need to know the flow rate, which is milliliters per hour or milliliters per minute. You need to know the drop factor, which will be given to you, which is drops per milliliter. And you can see it's given to you here on the label, 15 drops per milliliter. And those two pieces of information, you can get your drop rate. The only thing that would change is you might need to calculate or convert hours to minutes, or you just would leave it alone if it's already in minutes. So like the example here, it said 275 milliliters in 25 minutes. So 275 over 25. I don't need to do any kind of converting. I don't need to convert it back to hours or anything like that. I would just leave it as 275 over 25 times 15. And then I would get this huge number of 165 drops per minute, which seems like a real big number, but I also chose big numbers. Now in this, it also gives you some information that is extra, like it tells you 125 milligrams of a particular medication in dextrose 5% water. You don't need that 125 milligrams to answer the question. And the analogy I use for that is, if we're both driving to Kennywood and we're going to meet at Kennywood, and you're in a Tesla and I'm in a minivan, we're both going to be traveling probably about the same rate of speed to get to our destination, assuming we're leaving from about the same point. And we're not necessarily, it doesn't really matter what vehicle you're in. That's more about, that you're in the right vehicle, your own vehicle. And just like it's important to make sure clinically that you're administering the correct medication. But as far as the math is concerned, we're only are concerned with the volume and the time. And so when you're calculating flow rates, it's all you care about. So you really don't need to know or really worry about the milligrams, the micrograms, the grams of a particular medication if they're just asking you the flow rate. You just assume that it's there and it's being infused with it. So it's a distractor. It's something that's extra information that you need to be able to discern that you don't need to solve the particular problem. So let's look at the drop rate question I have not gone through yet today. And that is this one here. I think it was just that one. Yeah. So it's another one that's labeled. It tells you that it's 10 drops per milliliter. So it's already got the tubing information. And then what I'm going to do is I'm going to change some of this stuff up. So I'm going to make this be 500 cc's. And we're going to make this be 1.5 hours. Okay. And the question says, to calculate the drop rate, if you have a drop factor of 10 and you have an IV that is infusing at 500 cc's over 1.5 hours. So let's figure it out. So remember, again, I need two pieces of information to solve this. I need the flow rate and I need the drop factor. And that will give me the drop rate. Sorry. So flow rate is either going to be milliliters per hour or milliliters per minute. Drop factor is drops per milliliter. And the drop rate is drops per minute. So it tells me I have 500 cc's and 1.5 hours. I have a drop factor of 10. Now you should know that ml and cc are equivalents, so we can say they're the same. Now, before I do anything, remember, I'm looking for, and it says here, I'm looking for drops per minute. So right now I'm in hours. I'm not in the right format. I need to convert those hours to minutes, meaning I need to make another conversion factor, and I'll show you an alternative way for this. But I need to make sure I account for getting rid of the hours and converting that to minutes. If I don't do that, I'm not going to get the right answer. Now, when you set up a long dimensional analysis like this, sometimes it could be a little overwhelming, but the secret to this is just taking the information. So 500, so I have 500 times 10 divided by 1.5 and divided by 60. You just plug in all the information. And what you're going to get is 55.5555555. Okay, so it's 5 repeating. So 55.555. It just keeps repeating. Remember, I can't give somebody a partial drop. So what I'm going to do is I'm going to round this to 56 drops per minute. The alternative way of doing this with like kind of saving a step as far as dimensional analysis is concerned is take that 1.5 and multiply it by 60, and you're going to get 90 minutes. So 1.5 hours obviously is 90 minutes. So another way you can write this equation is taking the 500 cc's divided by 90 minutes times the 10, and then you can ignore now the this last step here, but you're still going to get the same answer, 56 drops per minute. All right. Lastly, the kind of one of the newer questions that you might see that could be a little bit challenging is one of these what we consider a multi-step question. So what I'm going to do is I'm going to give you a different scenario. There we go. Oops. Okay. I don't know why that's in red. Put that in black. There we go. Sorry about that. It's giving me, I meant to change the font color to black. Okay. All right, so let's say I have let's create a scenario here that's similar to this. So this is considered a two-step type problem. What that means is you have extra information. You have a loading dose, milligram per kilogram. You have a continuation dose. Then it tells you you're available, and then it tells you the patient's weight. Okay. So what I'm going to do is I'm going to change this up. I'm going to make this be, let's just do this as, let's do 15 milligrams per kilogram. We'll keep the dilatant available 125 milligrams per milliliter. And then let's make the patient be 177 instead of 157. And what we're going to do is we have to first convert the patient's weight in pounds to kilograms. So I'm going to take the 177 pounds. I'm going to divide that by 2.2. And I'm going to get 177 divided by 2.2. I'm going to get 80.454545. So we're going to round that 4 to a 5. And we'll just say 80.5 kilograms. Then I'm going to take that 80.5 kilograms, multiply by my 15 milligrams per kilogram. And what we're going to do is now we're going to get rid of the kilograms. So 80.5 times 15. And I'm going to get 1,207.5 milligrams. So now I have a milligrams, like a regular order, like you're already familiar with. So like this would be the same thing as if it said 250 milligrams, how many milliliters would you order or administer? So this is telling you 1,207.5 milligrams. So this is, if you like doing order over available or desired over have, that works. And I'll show it that way. I'll just divide by my available, 125 milligrams, times my quantity. And then I'll get 9.66 milliliters. And I'm going to round that to 9.7 milliliters. And then that's how many milliliters you would administer in this given scenario. So those are kind of the new things that you're going to see this semester. So I'll just say, if you have any questions, just unmute and let me know, or just type into the chat. But I'll just be quiet for a few minutes and see what you say.
Thanks so much. Have a good day.
Oh, you're welcome. You too. Yeah, and if you're done, then that's, if you just wanted to kind of just see where things are, if you don't have any particular questions, it's fine. You don't have to stay.
Okay. Yeah, I'm probably done with this. I don't have any particular questions.
Okay, fair enough. Well, yeah, and
Thank you so much.
you're welcome. And if anything does come up, just feel free to email me, okay?
Absolutely. Thank you.
You're welcome.
Bye-bye.